Greetings from Team Fetosense. In this video, we will have a short demo of Fetosense wireless NST-CTG machine. As you can see, the machine is completely wireless and portable. At front, we have an Android tablet which acts as a display screen for the test. And at the back, we have a central charging station in which all the probes consisting of US1, US2, Toco, and movement marker are attached to the central charging station. Also, it has an inbuilt speaker inside it so that heartbeats can be audible clearly and loudly. For switching on the central charging station, here there is an orange button. We need to long press it so that it gets activated. Then we need to open the Fetosense Plus application in the tablet, which is this is the home screen. Then after it will automatically get connected. Then we just need to remove the FHR probe from the charging station. It automatically gets switched on. And based on if you want to use it like a normal Doppler, we just need to place it on the mother's tummy. It will show you the readings over here. Plus on the FHR as well, it will show you the reading like this. FHR 160. And if you want to perform a complete test, we have a start new test option. You can just click on this. It will ask you some patient details. You can just enter the patient details, like what is the patient name, what is the age, what is the LNP, and it will directly take you to the test screen. So now on the bigger graph, it will plot the reading of the FHR probe. On the smaller graph, it will plot the reading of the Toco probe. On the right side, we can see the readings of FHR 1 year, FHR 2 year, Toco year. Plus, we can also monitor patients' vitals over here, in which we can monitor patients' blood pressure, mother's heart rate, and some more features. From here on the top bar, we can select the time duration for how much minutes we need to perform the test, like 20 minutes. If we have selected 20 minutes, it will go on for 20 minutes and then it will automatically stop the test. For performing the test, you just need to remove this FHR probe from the charging station. We need to place this on mother's tummy so that it starts detecting the heart rate. And once we start getting the readings like this, it is system ready, we need to click on the start button. So then it starts plotting the graph. In between the test, if it detects any abnormal situation, so it will machine alarm, just like tachycardia or bradycardia scenario, just for indicating doctor, and the FHR section will blink like this in red color. After 20 minutes, it will stop the test. So after the test ends, the final test looks like this. Here on the left side, we can see the graph. On the right side, we get all the automated results, which is generated by the machine, which is consists of basal heart rate, acceleration, deceleration, short-term variability, long-term variability, and many other parameters. Plus on the graph, as you can see, it also gives you color codings. For example, if there is an acceleration, that part is highlighted in green color. If there is any deceleration, that part is highlighted in red color. And if there is any signal loss, that part will be highlighted in gray color. Doctor can use this manual movement marker for giving patient and telling like if you feel any movements, she can just manually mark on this. That will also get plotted on the graph. And here we can also have a total count of movements over here. This is how you can perform the test in Fetosense CTG machine. And we also have a remote monitoring app in which if the doctor is traveling or sitting in a different place, he can monitor the test which is going on in the hospital on live manner in a smartphone device. For example, here if we start Kiran test new, click on new test. So we have a remote application for doctors. So if I click start new test, here it will show us live. So if I just click on start new test, it has started live now. And doctor can monitor the live test on his smartphone device from anywhere in the world in a real-time fashion. And you can also view the previous tests which are done like this. And it will also show the automated interpretation with the color codings in a real-time fashion. So this is how our remote monitoring works. If you want to take a printout in Fetosense Plus, the test comes on normal A4 size paper, which saves your cost as thermal paper is expensive. Plus, it also gives you a more detailed report, which consists of hospital name, doctor name, date, and all the reports parameters, auto interpretations which are seen on the tablet gets automatically printed on the graph. Plus, the graph is also color coding just like device, green for acceleration, red for deceleration, and it also has a doctor note section over here.